Hello. Section 48 is a transfer direction to hospital for a prisoner who has not been sentenced. It is one of the forensic or criminal sections of the Mental Health Act, found in Part 3 of the Mental Health Act. Two doctors, one of whom must be Section 12 approved, must write reports, and the Secretary of State must agree with them that the prisoner needs to be transferred to hospital. The prisoner must be suffering from a serious mental disorder, and the prisoner must be in urgent need of treatment, and the treatment must be available in the hospital to which he or she is moved to. If there is a public protection interest, that is, the prisoner may be dangerous to the public, then a Section 49 may be added as Section 48, and this is known as a restriction direction. This means that the patient will not have any leave or be discharged from hospital without the prior agreement of the Ministry of Justice. The patient on the Section 48 will remain in hospital either until the responsible clinician, who is the person in charge of the patient's treatment, feels that the patient no longer requires treatment in hospital, and then the section will cease and the patient will be transferred back to prison, or until the prisoner's or patient's case is decided in court. From that time, the Section 48 will cease and the patient may be sentenced to prison, or if they need further time in hospital, they may be put on a Section 37 or a Section 3741 if there are issues of public protection. Patients on a Section 48 can be given medication without their consent. However, their consent is always sought. After 3 months, a second opinion appointed doctor will see the patient and assess their capacity to consent for treatment, and also whether he or she does consent to treatment. If not, then the second opinion appointed doctor must agree with the responsible clinician's treatment plan that this is the best thing for the patient. The patient may appeal to the Mental Health Tribunal once in the first 6 months, once in the second 6 months, and then annually thereafter. They can apply to the hospital managers for a review. However, the hospital managers will not be able to discharge the patient from the section, but they can write to the Ministry of Justice suggesting that this should be done. Thank you for listening. Bye for now.